I'm Dr. Tyler Williams with Pinecrest Dental, and you're here because you may have too much saliva in your mouth or you feel like your mouth's drooling all the time, and so we're here to share some insight on why that may be happening and ways that we can provide some tips to help you, some things you can start doing today. And then of course our contact info, if you have any questions, you can call us and ask. We have some handouts and guides that we like to share with our guests and patients and people with our membership plans, and so we'd be happy to send you a copy of that so you can look it over and see if that may be helpful for you. So the first thing to know is that lots of saliva isn't as bad of a problem as the opposite, which is dry mouth. So more and more adults suffer with dry mouth from different medications, surgeries, if someone who's had chemotherapy sometimes, breathing disorders, asthma, sleeping disorders, sleep apnea, snoring, those kind of things. Those cause drier mouth. So you may even be suffering with some of both, or maybe during the day your mouth feels like it's too much saliva and other times it's too dry. But for purpose of this video, we're focusing on too much saliva, and in some of our other videos we talk about dry mouth and some things you can do for that. So with your saliva, one thing that we found very, very helpful, it's a new technology. Very few offices have this yet, but it's really cool. It's a saliva test, and it's really easy to do. Basically, you spit in a little tube, and we dip it into a stick and put it through a computer we have, and it analyzes your spit. It tells you a whole bunch of things about your mouth and your health and your body, similar to what a blood test would do if you were going in for a physical or a checkup with your physician. We're doing a checkup on your mouth, which is the gateway to your body. So with this test, it will tell us things like how likely are you to have bad breath? Are there proteins in your spit which could indicate signs of inflammation or other health issues? It will tell us about white blood cell count. White blood cells go higher when someone has infection. We see this a lot with people who have gingivitis, and it can also be people who have things like autoimmune issues, diabetes, high blood pressure, digestive issues can have higher white blood cells in your spit. And so this test allows us to analyze that for you so you can be in the know of what's going on and things you can do to help turn that ship around, so to speak. It also looks at how likely are you to get cavities, so your risk factor for tooth decay, dental decay, and also your acidity in your mouth. So this is something we see a lot. We meet with a lot of patients who are frustrated because they brush every day. Many of these people even floss on a regular basis, but they still get cavities. They still get root canals. They have caps that break off. They have teeth that are sensitive or hurt. And unfortunately, for most of us as adults, brushing and flossing alone is no longer enough. So it doesn't mean you shouldn't do those things, because you absolutely should, but the truth is there are more things that a lot of us need to be aware of and involved in that will help keep your mouth healthy and avoid some of those problems. So one example is if you have a high acidity level, we have you swish your mouth with water more regularly throughout the day, because that helps neutralize the acid so that it doesn't sit on your teeth, which causes sensitivity and yellowing of your teeth and your teeth wearing down faster, getting smaller, those kind of things. And a lot of people complain about that. A lot of people come see us because they feel like their teeth are yellowing or they're getting smaller, so they find us, and rather than just fixing your tooth, we prefer to help you fix the problem and then make the teeth look better at the same time. But not just make the teeth look better and then in 2 or 3 years have all of that dental work fall apart, or you're back in the same boat because you're experiencing the same issue. So if you're drooling, feel like you're drooling more than you should, could be signs of inflammation in your mouth or dental disease, and your body's trying to fight that. So we invite you to give us a call, come in for a saliva test, and we can measure all of those markers and give you a good reading on that. Something we can also send to your physician, because it goes hand in hand with what you get checked at your doctor for your physical checkups and your blood tests and those kind of things. So if you have some questions, like some more info on that, please give us a call, and love to help you with that. And we also have a guide that I use personally. It's how I avoided cavities for 8 years in a row. Some things that I do at home, as I mentioned, in addition to brushing and flossing, which may no longer be enough for many of us. So thanks for watching this video. Please leave your comments below. That helps us make others, and for people like you who are trying to learn more about this and see how we can help. So have a wonderful day, and we'll catch you on the next one.